Is the doctor-patient relationship in jeopardy? Find out on Medical Economics.
Everyone has different goals, desires, and different ways that they see themselves in practice. And for me, I wanted more control over the way I did things. I explored a lot of different options and decided what made the most sense for me was to actually go in the opposite direction and open up my own independent practice. And much to everyone's suggestion that it couldn't be done, it can be done.
Physicians crave autonomy. They are independent thinkers who want to use their expertise to treat their patients the best way they know how. This disposition often comes into conflict with today's healthcare system, which favors large and growing hospitals and corporations. The number of independent practices is dwindling. Most young physicians aren't leaving residency and opening a new practice. Instead, they are more likely to go work for a large system. But every year, there are physicians who go the other way, who buck the trend and go work for themselves. That's exactly what Dr. James Underberg did. He opened a concierge practice in 2009. But there's no roadmap for physicians like Dr. Underberg. We sat down to discuss the benefits and challenges of opening a new practice. So, Dr. Underberg, why did you decide to go out on your own again and open a practice?
I had been in a large multi-specialty group practice for many years, and that was the only type of practice I knew. Our practice was being acquired by an even larger practice, and I made the decision at that time that it wasn't right for me. Everyone has different goals, desires, and different ways that they see themselves in practice. And for me, I wanted more control over the way I did things. I explored a lot of different options and decided what made the most sense for me was to actually go in the opposite direction and open up my own independent practice. And much to everyone's suggestion that it couldn't be done, it can be done. It's not simple, it's not easy. Many physicians don't like being their own boss anymore, although that was something and it was a reason a lot of people used to go into medical practice many years ago. But there are lots of people available to help you in this process. And so all you need to do is find the right people, get the right suggestions, research things very carefully, spend some time learning and understanding. It can be done. And nothing's simple, nothing's easy, but oftentimes taking control back and being more independent in the way you see and manage your own practice leads to more professional satisfaction if that's what you're looking for. And so I tell people, don't think that there's only one way of doing things, because there are options, and you need to imagine them before they happen.
What are some of the major challenges that you experienced, and how did you go about solving them?
I think the first and most important thing is making sure you explain to your patients what you're doing. And so if you're leaving a large group practice, you want to make sure that there's a way you can communicate to your patients that you're leaving. Often there are legal issues around that, depending on what the structure is of the group you're participating with, or a member of, or a partner of, and how you're leaving. But ultimately, the one thing you do have to remember is that patients can do whatever they'd like. And so if you do leave, patients often find you. And if they have a good relationship with you, they will seek you out. And that's the one thing I remind people, is that it's all about the relationships you have with your patients. That's the strongest thing that ultimately leads to the development of independent practice. The next is that once you are in independent practice, or you're starting an independent practice, is making sure you have the infrastructure around you to make that successful. That means good legal advice, good financial advice. If you're going to be moving to a new facility, finding a place that works for you, both physically, structure-wise, workflow-wise, and also financially. For me, it was making things as simple as possible. So I didn't want to have to reinvent the wheel. It was much easier for me to find space in a pre-existing doctor's office than build my own space. But other people like to start from scratch, and that's always an option too. Finally, I remained participating in most of the insurance plans I was in, so I had to recontract with most of those plans. And there are plenty of people available to help you with those processes, including many of the small EHR vendors who are willing to also help you with billing, contracting, and credentialing. So there are a lot of options out there. You just have to set up the structure and the infrastructure to make it something that works well for you.
What strategies did you use to convince your patients to follow you to your new practice?
For my transition, it was fairly easy for most of the patients to follow me. They had seen me for many years, and I was encouraged by how many wanted to continue to see me in my new practice. I think one of the most important parts of this process is to make that transition simple and easy for the patients. So they should be able to reach your office. There should be lots of different ways to contact you. Your office should be very helpful in making sure that records can be transferred. And you want to make sure that you have a good transition and relationship with the practice you're leaving so that that transfer of records is simple and easy for patients who want to make the move. Ultimately, it all comes down to ease of communication. And if that process is simple for the patients, it's very easy to make the transition. If the patients perceive barriers, whether it's communicating with you or getting records transferred, having things proceed as smoothly as they had in your old practice, then they might not come. And so I think it's important to define those concerns and issues early and make sure that you've worked through all the kinks before you make the move.
You obviously learned a ton opening your new practice. Is there one thing you wish you knew then that you know now?
If I was going to do this process again, there aren't that many things I would do differently. I might start the process earlier. I think interacting with experts who have helped physicians do this is a key and important part of this process, and there are lots of people available who can help guide you and who have gone through the process before. And connecting with them long before you actually think making the move is going to happen is probably the thing that I would have done differently. I waited, partially because I wasn't sure what I was going to do, and then once I left, things took a little longer to be set in place. The other thing someone told me, which I thought was very wise, was that once you make the move, realize that it takes almost a year to have everything working the way you want it to. And so take a deep breath and realize that nothing is perfect right off the bat. And you're just going to have to live with that in the beginning because you've been somewhere else where things are working relatively smoothly for a long time. And so knowing and understanding that, I think, helps you get through those rough spots in the beginning because there's always going to be something. The phone doesn't get connected the way you thought it was. The electronic records don't transfer over the way you would like to. Or the internet isn't working properly. The EHR doesn't work properly. And so you just have to give it time.
So for the physician that's watching this, that's thinking about opening their own practice, what advice do you have for them?
If a physician was thinking of making a move from a large practice to solo or independent practice, the first thing I would advise them to do is to find or seek out someone else who has already done it and talk to them in detail about all of the things that they thought went smoothly and all of the things they thought maybe didn't go so smoothly and what their options were. I think the more people you talk to, the more you learn about the best way to make it happen. All that said and done, be flexible because things don't always work out the way you think they are. Perfect example is I chose an EHR system and several weeks in realized it wasn't right for me and stopped and moved to another one rather than continuing with one that I realized wasn't right for me. And so again, understanding that you may make a mistake and it's okay to backtrack, I think is another key and important factor.
So in recent years, there's been a huge growth in these convenient care clinics where patients can go and get treated for minor issues. What impact do you think these convenient care clinics has had on the competitive landscape for practices?
I think the emergence of urgent care facilities has benefits and also has some problems or some issues. For people who have an immediate urgent issue on an evening or weekend time, not having to sit in an emergency room for hours, I think is a good thing. My concern is that many people are starting to use urgent care facilities for their ongoing preventive or primary care. And there's a lack of continuity, often if they go from one facility to another or seeing different providers all the time. And so I do think that it's a tool that can be used wisely by people in practice. Patients, I think, can leverage urgent care to make their immediate concerns more easily addressable. But I do think it shouldn't replace the ongoing role between a primary care physician and a patient with regards to their ongoing preventive medicine. My experience with patients who visit urgent care facilities is that they have to be very proactive in making sure records from that visit are forwarded to us. More often than not, we either need to spend time on our own getting those records or asking the patients to make sure they're sent to us after the fact. Patients often are good about telling us they were at an urgent care facility, but making sure we get those records and a copy of what happened or the testing that was done is not always forthcoming. And so being proactive in that role, I think, is key and important.